What made you to work as a what? A doctor. Just so we are clear, can you just tell us all these qualifications? What are they? You can just narrate them again. Bachelor of something, master. Yes.
Bachelor of Medicine and Surgery. You are permitted to work as a medical officer, which I did those years. Then I returned to my career that I studied for a master's. And I qualified in 2003. Fellowship in trauma, South Africa, and I qualified. And I also sat there fellowship exams for the higher diploma. And then I returned to that work.
Okay. And what? When did you return?
I returned at the end of 2004.
And what do you currently do? What's your work that you return to?
I am an orthopedic surgeon, and at the same time, I do medical training of orthopedic surgeons at Makerere University as a senior lecturer and head of department of orthopedics.
Sorry, let's just go slow. At the same time,
I do training in medicine in the field of orthopedics, and I'm the current head of department of orthopedics. My private practice.
So before you reach your private practice, you're the head of department where?
Yeah, at Makerere University.
This is in which college, in which school?
The college.
And do you do any work in a public hospital?
The public hospital where we do training is Mulago National Referral Hospital. That's where my offices are. So we do 3 activities there. We treat patients, and then we do research, and we do training of the future orthopedic surgeons and other categories of doctors.
So are you a head of department there? Where are you?
Yes, I'm head of department.
So you are saying?
So I've said I work at Makerere University as head of department of orthopedics,
Yes.
as an orthopedic surgeon.
Yes.
And we do 3 activities. We do training of orthopedic surgeons, research, and we participate in the clinical service delivery. Now that's operations and clinics and everything that is done. And then at the same time,
Yes.
I do some private practice. Now, KMC Care, Namuongo.
What do you do there?
I run clinics, and when there are emergencies or operations to be done in the field which I specialized in, I do them. That's orthopedics. Yes, I run clinics. Running clinics means you see patients on a designated time, on appointment.
May the witness be reminded that we need to write
Yes. When you need clarification, I'm going to give it to you.
We are just requesting that you speak at Penny's speed.
Oh, slow speed, okay. So I conduct clinics for orthopedic patients, and I carry out ward rounds for the patients that have been admitted according to the duty roster, and I conduct operations, okay, when I'm called upon to conduct the operation.
What, if any, research have you been involved in yourself?
I do research in the area of specialty of orthopedics, and I supervise my students' research before they qualify for Masters of Orthopedics. And I've been publishing. So I don't know what more you want to know in that field.
Doctor, very briefly, can you help us to understand what you mean by orthopedics?
All right. Orthopedics is a field of medicine that takes care of ailments in the musculoskeletal system of the body. And the musculoskeletal system.
A field of medicine that does what? Sorry?
That takes care
Yes.
of ailments in the musculoskeletal system.
How do they spell that in that?
Musculo. You remove the AR of muscular.
Okay.
Put O.
Okay.
And then skeletal, musculoskeletal system. We take care of elements in that system. Involves bones.
Involves what?
Bones.
Bones.
Joints. Right? And the soft tissues that assist locomotion of the joints. And those soft tissues,
Sorry?
mainly.
Just slow down. The soft tissues that assist in the locomotion of what?
Locomotion of the body, right? Okay. So if I can enlist them, if you need, they're mainly tendons, ligaments, and other soft tissues. But that's basically the area we work.
Okay. Doctor, do you know Mole Katanga?
Yes, I know her.
Can you see her in this court?
I think I can identify her from the eyes, because I took some time to treat her on the screen.
Okay. She's the person on the screen. Maybe she can remove her mask.
Maybe she can remove the mask and confirm that. Yeah. Right?
Just you need to say it so we can record.
Yeah, she's the person.
Is the person
The screen.
Can you tell this court how you came to know Mrs. Katanga?
On the morning, it was early morning, because I used to go very early that year. That is 2003. It was the second day of November 2003. I'd gone to run my usual, or to conduct my usual activities of the clinic. And then, because the hospital knew that I'm usually in hospital before 7 o'clock, they contacted.
Sorry, just confirm the year. What year was that?
It was 2023. Okay. I'm sorry about that. 2023. Okay.
Yeah.
Yeah. And because they know my schedule, they told me that there was an emergency case in the emergency area of the hospital that needed my urgent attention.
Who told you?
The hospital, through the system of the hospital, I was informed that before I start the clinic, I should go and see that patient. So I went to the emergency section to see the patient, and I found the client on the screen. And the reason why I was told to go and attend to her is that she had injuries. Now, when I found, yes, am I so fast?
Yes, you are.
Yes. I'll stop. Let me to continue.
Maybe before you continue, my lord, we can take a interpretation. Doctor, we interpret in Rutoro for one of our people, so one of the accused.
daktari akutumiza amagufa ya muno akora muno ali kwitanga kwa amagufa kandi bino bino yasomereye nisomitegerere ya makerere rikuru na hano umwaka gwa 2009 kandi yasoma urupapuro rukoyongeraho nabo mwebyo byenyini mwitendekero miliyoni yavugaho yagenda mu nzego ya South Africa kandi nabo yatunga ubutendekero bw'obumu yekare kaguzo ebyakire kandi ebikaba byamuhaire obusobozi okukora omukiikare ya South Africa baitu akacamugaruka mwaka 2004 nikugwaho daktari asemeza amagufa kandi atendeka ronda asomesa mu byamagufa kasaha eno niwe akura ekyo ekishweka ekitendekero lya makerere ekikora erundi ekisomesa ebyamagufa akora okutendeka abaana bano mwirwanire ekula yabo kandi nibo noonya amakorero y'emirimu eri kandi bakino bajanjaba abalwaire abamagufa kandi bakabuliriza rundi baserukiriza hari ebintu nibyo bimu kandi akora n'emirimo eyewenka nk'omuntu eyakora hairwaro eryo erya namongo lyanyumira ibara kandi ibaro lino arora abalwaire abaine endwaire zikwatagana amagufa ayetolora hali abalwaire baba bali bajanjabirwa kandi akora ebyokusemeza kakusangwa baba bamwesererungi kakusangwa atibanitekanisa akora ebyokuseruriza kandi akura abaana baba nibasoma nibakora ebyokuseruriza kandi n'ebihandiiko ali ebintu bino omukyala mule amumanyire kandi ekiro ekyakeseze ebyo byokwezi 2 okwezi kwe 11 omwaka 2023 akaba nabo agenzere okora emirimu ye nka buli kiro mu bibalo omwo alakoora batawoka bakamanyire nti akeera muno akeetebwa mu bwangu alole omulwaire akaba aleeserwe mu kaseera kaikusibwamu abalwaire ababwangu
My lord, maybe just so we're all on the same page, maybe where we stopped.
Was called to the emergency. Went to attend to her before.
Doctor, just remind us what day that was.
That was the 2nd day of November, 2023.
Okay, now maybe you can describe for us what you saw. When you saw her, what did you observe?
She had heavy bandage on her head, and then she was being taken. That was being taken care of by a neurosurgeon.
Just slow down. Being taken care of by
A neurosurgeon, right?
Okay.
Okay. And my area that I was called to assess was the limbs, the upper limbs.
You were called to assess which part? Sorry.
The upper limbs.
And in simple layman's language, what are the upper limbs?
These are the hands and the forearms and then the hands. Hands, forearm, and the arms. Those are the upper. Those comprise the upper limb.
The hands, the forearm, and the
arm.
And the arm.
Can I explain what I mean?
Please do.
So the hand is this part, right?
Which part?
Finger.
Because we're writing.
That's
the hand
this
has
part and the fingers.
No, please tell us the part. Which part is that?
This is the hand, right?
That's the palm.
Which has the palm and the fingers, right?
The hand has the palm and the fingers. Okay.
And then you have the forearm, which goes right from the wrist down to the elbow.
So you just slow down. The forearm goes from where?
From the wrist to the elbow.
Okay.
And then the arm is the part above the elbow to the shoulder.
Okay. And then what did you observe about her
yes,
upper limbs?
The upper limbs, she had the following injuries. I'm going to state. In the area of the fingers, hand, wrist area, and the forearm.
She had injuries in the fingers.
Okay. The fingers,
the wrist,
the palm, the wrist, and the forearm.
And
on both sides.
On both sides.
Yes.
Now, doctor, we'll get into the injuries shortly.
Okay.
So what did you do after you assessed that? What do you mean by both sides? Sorry.
On both the left and the right.
Those are the hands
of the
And did you observe any other injuries on her body?
I said she had a heavy bandage on the scalp of the head.
Okay, and now, doctor, so after you... Doctor, so after you assess her with the injuries, what did you do?
So we agreed with my colleague that the patient should, as urgently as possible, be taken to theater for management of the injuries that she had. And
sorry, just name the colleague. What's the name of your colleague?
It's been a while, but I think is Onen. The name should be Onen. I mean, the hospital probably should have that exact detail of both names and whatever.
Okay, so you agree with Dr. Onen. What did you agree with the doctor?
So we agreed that the patient, as urgently as possible, when theater is available, should be taken to theater, and we'll work on the different parts
should be taken to theater, and you work
Yeah.
on the.
on the past on the injuries that she had.
Okay. Was there an order in which you would work on her?
Because of the urgency of the bleeding on the scalp that I came to understand, and the brain, I mean that bleeding is the most urgent issue that should be.
This is bleeding on the what? Sorry, you
On the
meant
scalp.
on the scalp.
Yeah, because that's why it was heavily bandaged.
Okay.
So the first part was for him to arrest the bleeding from the scalp, and then stitch those wounds, and then I come in to perform the procedure on the upper limbs. I'm using upper limbs because I cannot be repeating all the parts every time I speak. Yeah.
That's okay. Now, and so can you tell this court about the surgery you performed?
You don't want to know about the diagnosis I made before I go to the surgery?
Fine, please tell us the
Or to
diagnosis.
find the injuries clearly.
Oh.
Now, in medicine,
Oh.
for us to come to the conclusion of what injuries the patient has got, we inspect, we palpate.
You inspect, please speak slowly.
Inspect.
You
right?
inspect, then you palpate.
Then we palpate.
How do they spell that?
Palpate is P-A-L.
Okay.
P-A-T-E.
Yes.
In other words, you touch to see tenderness, where it's tender and that kind of thing, where possible.
Okay.
Sometimes we don't want to do it because it causes pain on the patient.
Okay.
Then after assessing, we usually do X-rays.
Okay.
To see the bones, the status of the bones and the joints.
Okay.
Yes. So, and that process, we can start from the emergency up to the theater, because in theater you open again the limbs and see things more clearly. So, and these are the injuries that I found out after all those.
Okay, just slow down.
Processes.
You start from the emergency, you said, up to theater.
Yeah, you can see what you can see in emergency, okay, because sometimes you don't have to cause pain to the patient or that kind of thing. But when you reach theater and she's been put under sleep, then you even look more, because now you take off everything and you can see the injuries even more clearly.
Okay, so just hold on. Let's record that. Just hold on, doctor. Yeah. So in theater, she is put under what?
Under sleep. Anesthesia.
Under anesthesia.
Yeah. You told me to be a bit simple. So.
Yes. Under anesthesia, which means sleep.
Sleep, yeah.
And then you can see the injuries. What?
Yes.
You said something
more clearly, because now you take off the dressing in preparation for the procedure.
Okay, just.
Giving us hypothetical scenarios, or is very important what he did.
I'm telling you what I did and how I make my decisions as a professional. So in this case, so what I did is, let me tell you what I did, because I first explain why I did it.
Yes.
Right?
It's okay, doctor.
Yeah. So I explain what I did.
So just to be clear, no, before that, just to be clear, before that, you have explained to us what happens in an ordinary patient from the time from emergency to theater.
To theater, yes.
Now, in this particular case?
In this particular case, so I found the patient with dressings on the upper limb.
Okay.
And then I had to first assess, because she had pain, I had to look at the X-rays,
so
right? Because
you looked at the X-rays?
Stress and pain. So the X-rays revealed the injuries that she had, and because she had dressings and they were a little bit soiled, I needed to do more assessment in theater.
So by dressing, can you explain?
Yeah. Yeah, I slow down.
You have to look at the X-rays.
Yes.
You
Yes,
to not cause harm.
Yes, yes.
Then you.
Then of course we agreed that the injuries she had and the dressings, meaning that there's a possibility of open injuries. We take her to theater and assess those injuries more, and then I do the procedures I had to do on the ribs. After my colleague had stitched the skull.
And as you do this, as you did that, did you make any note, any clinical notes? Do you write on anything?
Yes, we write notes at the end of the procedure. For them theater notes.
Doctor, if I showed you your theater notes, would you be able to identify them?
Yes, I know my handwriting.
My lord, if the perioperative record for the okay, doctor. Do you see the notes that you made?
Yes.
Where would you find them?
They are at the end of that pamphlet. The very last. Can you hear me?
No. Everybody can be translating. Okay,
Hello?
is it on?
Yeah. Sorry.
Okay, so can you identify your notes?
Yes, I can identify my notes.
Okay. And what shows that they are yours?
The signature, the handwriting.
And is there, what page are they on?
Page 15. Because my colleague had written on page 14.
And this document, what do you call this document?
Theater notes. The theater notes, you can see on page 8 and 9, we have the anesthesia record. And the patient was in theater being worked on, page 8 and 9. And then we perform the procedures, and the one who does the procedure first writes the notes. And because in his procedure, he writes also treatment. Yeah.
Slow down.
Maybe technically constrained. But the doctor, my lord, restricted what he did, as opposed to what other people did.
My lord, I think you just explained to us the document.
My lord, he can't be explaining to court what other people did.
I think he's just leading us to his.
I was just leading, but it's fine. I'm going to tell you what I did, right? So after my colleague had done his part,
Yes.
and I was in theater, and he had stitched all the lacerations, I now was supposed to handle the injuries that I found from my assessment. And these are the injuries I want to describe before this court.
Wait, before that, we shall come to the injuries.
Right.
Are they detailed on your clinical notes?
I mean, I hear I'm writing just the things I did
In the theater?
in the theater, yes.
Just hold on, just stop there. So your clinical notes, the theater notes, do
Yes.
what? You're just writing what?
On the procedure I did, right?
Okay. And doctor, I'll come to that. Don't worry. I'm just first establishing
What I did, all right?
a scheme, and then I will come to the injuries.
Okay.
So, apart from treating her in theater, did you have any other interactions with Mrs. Katanga?
Yes. When I finished treating her in theater, I followed her up on the ward for several occasions to ensure that the injuries are healing. And I interacted with her during that process.
Regarding the following up with her, apart from Mrs. Katanga, tell us if there were any other people who you interacted with regarding her care.
I remember one relative.
Okay, so you're in touch with her relatives?
Yes, I was in touch with one relative.
Okay.
There's a gentleman called Mr. Kamuntu.
Okay, apart from Kamuntu, is there any other person you?
No, that's the one I interacted with as a caretaker.
Outside of her family, did you interact with any other organization?
No,
Okay.
I just did my professional work. That is in the ward.
In the ward.
Okay. One relative. Yeah, the caretaker. Any other members?
So, tell us.
After the theater.
Okay, tell us what, if any, contacts you had with the police.
The contact I had with the police was that I noticed that the patient had a security group at her entrance, and every time you come to do a ward round, they would make you sign in the book, and then I enter and I see the patient, and then I get out. That is one contact. Then the second contact I had with the police. Yeah.
And that was the police.
Yeah, it was.
No,
It was police.
No.
Yes.
Okay, who was that?
My lord.
The patient had a security.
It's security. Yes, and the police security. All right, at our interest.
Had security.
Yeah.
At the
Interest. Yes, and you would go through it to go and see her.
This is when she was in the ward.
Only she was in the ward. Yes. That is one contact. Then the second contact I had with police is with the police surgeon called Mr. Moses Yaruhanga.
Okay, just slow down with
Dr. Moses Yaruhanga,
okay.
who came to assess the injuries and requested the medical team, including me, to give the reports of what we saw and what we did.
So you gave a report to him.
Yes, I gave the report to him.
May we request, my lord, that the defense refrain from the pleading if they can get all materials from this.
Much obliged, my lord. Much obliged, my lord. Who did you give the report to?
The report was given to Dr. Moses Yaruhanga on his request.
If that report is shown to you, can you identify it?
Yes, I can identify the report.
My lord, we pray that the witness be given prosecution exhibit 121.
Oh, my lord, how?
Is that the report?
No, my lord, we can't even go there. We counsel is asking, can you identify it? He simply says, I can. Then he wants court to hand over the document. He has a duty to tell this court how he can identify exactly. Which report and how.
The report to Dr. Biahanga.
My lord, he's testifying. He's testifying.
My lord, the witness spoke about he wrote a report to Dr. Biahanga. I asked the witness, yes. And I asked the witness if the report is shown to him, can he identify it? He has said yes. And I've asked the court to give the witness prosecution exhibit.
That is not enough in exam chief. If a witness says he can identify a report, let him first tell this court how he can identify that report before the report is put to him. That is how it goes, my lord.
My lord,
Let him tell us.
can I have prosecution exhibit 121? Yes. My lord, let me have a look at it. So if it's shown to you, you'll be able to identify your report.
Yes.
And what was in the report?
My lord, surely.
What would enable you to identify it? My lord, there's no need for speech. What would enable you to identify it?
Mr. Karanga, will you hold on? My lord, we want to get this clear so that we don't keep disrupting. Mr. Karanga thinks it's a speech. It's a procedure requirement.
My lord, maybe
He has a duty and he has to execute that professional duty diligently. Let him stop leading the witness.
yes. So my lord, the witness has maybe already testified that he wrote a report.
Yes, he said that we were requested to give reports of what we saw and what we did.
Yes, in writing
Dr.
to Dr. Biahanga. Yes.
Then you ask if that report is given to you.
Can you identify it?
Identify that report. Yes.
Yes. So my lord, I want to now give him the report to see if he can identify it.
How will he be able to identify?
How will he be able to identify the report?
I signed the report.
Okay. So if I give it to you, will you be able to identify it? Your signature on it?
Yes.
My lord, can the witness be given prosecution exhibit 121? Maybe, my lord, you could be taking translation.
My lord, maybe we are getting.
Brazil karibu amazina muzika akasangaho omukyala Katanga ayina ebibuta bingi muno kabasibirwe okuba okwamaanyi amutwe kandi we bakaba bamwetere okukola hali kyekabuye ebyomaiso ebyemikono kutwala hamu mikono yona kutwala hamu kabeina ebibuta byalozere amasanga yene mikono ine ebibuta mukono gw'obulyo nomukono ogw'obumoso ayibire awutaziibwe bayikiraniza n'omugenzi we yeterwe daktari Onen nti omulwaire bamujja kumutwala mu kasika kasemezebwamu basobole okujanjaba ebibuta ekyo abo kwetaaga muno okw'omutwe ketagisa daktari ono abanze akole hali ebibuta ebyomutwe ebikaba nebijwa muno omusaayi wowe aija hanyuma akole hali ebibuta ebikaba biri mu mikono mu byemibazi obabantu bakola emirimu yaabo babanza kwetegereza kandi olungi kwetegereza olungi bakwatakwataho mpolampola ebibuta byomulwaire bakitini bakikola bakikola bityo bungi kireeta obulumi kale omulwaire kale omunkola nk'egyo bakola bakozesa akoma kamasanyalaze basobole okwetegereza luli okulola kiki ekiri omunda ebibuta bino kandi kino kisobola kutandikira akaikala akali abalwaire baikiraga obwangu obulwaire okumubyamya basobole okwetegereza kulungi baitu batakumuleetera olumi akasanga omulwaire ono ole Katanga ayina ebibuta bisibirwe nesibirwe hoona hoona kandi kyayoleka nti akaba ayina obulumi butamwogera bulumi akatunuula ebisesani ebyamuteirwe mu kigemu ekyamasanyalazi ati yakola yafuna ebyokuhandikawo ebimu ebyahandikire kandi ebyakusobola kwetegereza abokuba mukono gwe kandi haliho nomukono gwe omubugufu bino biri hatyo olupapula 15 olwekihandiko ekyakasika kasemerezebwamu ekibakola bakola omulwaire kandi kino biroho ebikwoleka nti omulwaire ono abibugwawo asobole kubyama hanyuma mugenzi wamazire kumubaziira okubaziira akamutwe hali akabalinojamu n'omusaayi akaija asobole okukola kali ebibuta ebyasangire kandi yamazire kumujanjaba akaikala namuwonera kali akaba bamuhaire ekiteekati bakaeza kulola nti kandi bakabaho nebibanga akalula munyoro kamuntu wetu atarole n'omuntu oli wena kandi alikwasagana na polisi rundi okuteesa na polisi okuyatungire okubanza niho akakiiko kino kali omulwaire baali bamuhaire ekitabo akaba halowo n'omulora kandi ekintu ekyakabiri omutondo wa polisi oyo yarozeeruwe daktari wa Ruhanga daktari wa polisi yaizire hali bali kwebera omulwaire ono kandi yasaba basobole kumuheerezaho ebihandiiko alimu byebakozere ebyo bamuhaire saha zino ekikwetegereza okumanya kandi nasobola kutugambira nti nkyekyo.
Much obliged. So, doctor, have you seen your report?
Yes, I've seen it.
How do you know that it's yours?
I signed it.
You signed it.
And these are the things I wrote at that time.
He signed it, and these are the things he wrote at that time. Now, doctor, very briefly, I want you to take this court through that report.
Okay.
I want you to read and explain, and I'll tell you wherever to explain. So, start with re.
Re, Miss Mole Katanga, orthopedic report.
Okay. What's the date?
13th November 2023.
So it is Miss Mole Katanga orthopedic report dated 13th November 2023. Who is it addressed to?
It was addressed to the Director of Services, Uganda Police.
Okay. Just read for us very slowly the first two paragraphs.
The above named presented to the Accident and Emergency Unit with scalp bleeding and laceration.
It's presented to the Accident and Emergency Unit
with scalp bleeding, comma,
yes,
lacerations.
yes.
Does anybody need to understand lacerations?
No.
Okay,
No.
wonderful. Painful wrists and hands following domestic violence.
Following
Domestic violence.
domestic violence. And then the next sentence.
And these are the orthopedic injuries sustained.
So now, Doctor, before you go into it, can you explain? These are the orthopedic injuries sustained by the
patient.
When?
On the 2nd November 2023, when I saw her.
And just to refresh my memory, you explained to us orthopedic medicine. Maybe in just a sentence, just tell us what
I said orthopedic medicine deals with the musculoskeletal injuries. In other words, the soft tissue surrounding bone and the bone injuries and the joints, and all those diseases that affect those parts of the body, right from the neck down to the foot.
Okay, so doctor, what's the first injury that you report?
So the first injury I report is ecchymosis on the ulnar side of both forearms.
Ecchymosis is E-C-H?
C-H-I-Y-M-O-S-I-S.
On
both
ulnar side?
On the ulnar side.
Of
ulnar
what?
Side.
Of
both forearms, and I emphasize the left and right.
Doctor, what is ecchymosis?
Ecchymosis is evidence of bleeding and in the soft tissues under the skin, defined by wide patches of darkening. Wide patches of darkening, meaning there's internal bleeding, and if somebody is light.
Slow down.
Yeah.
Wide patches of darkening, meaning there is internal bleeding.
Yes, internal bleeding from mainly trauma in this situation that we saw here. And the ecchymosis was characteristically on the ulnar side. Now, let me show you the ulnar side of the arm.
Yes, yes. That's why I was
the
going
arm
next.
has two sides.
So this is internal bleeding?
Yeah, internal bleeding.
Okay.
So this is the part I'm talking about.
Maybe you can explain the part in words?
Yes, we call this the ulnar side in orthopedics because the forearm has two bones. It has the main bone, which is the radius, and then this is called the ulnar. So this side becomes the ulnar side, and this becomes the what? The radius side.
So the side you're pointing at is the side from the wrist up to where?
So from here.
That is here
up
is
to
what?
the elbow.
You know where
this is the wrist. This is the elbow. So this section here.
So from the wrist to the elbow?
Yes.
It's called the what?
Ulnar side of the forearm. Okay.
So now, you observe. What did you observe on the ulnar side?
I observed ecchymosis,
which is internal bleeding.
Internal bleeding in the soft tissues.
Okay. The next one.
The next sentence is she's sustained fractures of the second and third metacarpal shafts of the left hand. And I'm going to explain what metacarpal is.
Yes. Just repeat it again. She sustained fractures
of the second and third metacarpal shafts of the left hand. And I'm going to explain second, third, and metacarpal.
Okay.
Because fracture known probably by everybody. Fracture means a break in the bone.
Fracture is a broken bone.
Yes, a broken bone.
So she had broken bones on the second and third metacarpal shaft of the left hand.
Yes, left hand. Yes.
So just first demonstrate to us.
Yeah. So this hand has.
You're showing the left hand.
Yes, I'm giving you the anatomy of the. So we say these are fingers, right?
Yes.
And in the fingers we have phalanges. Those are the bones we have in the fingers. They are usually 3-3.
So just hold on. In the fingers, the bones in the fingers, you have phalanges.
Phalanges, all right, which are supported by bones in the palm.
Okay.
And those are the metacarpals. Those are metacarpals.
Okay.
Yeah. So when we say a break in the shaft, it means in the middle part of these bones. Now, we name them from the thumb. Okay. Metacarpal 1, 2, 3, 4, up to 5.
So each finger
has 5.
Has a metacarpal bone.
Yes.
So you name them from the thumb is the first.
Is number 1.
Is number 1. So the index or trigger finger is number what?
Number 2.
Okay.
Then number 3.
So number 3 is the middle finger.
Middle finger. Number 4.
Number 4 is the ring finger.
Number 5
is the pinky finger.
Yeah, small finger. The pink finger.
So where is the second? Here you talk about the second and third. Okay.
So the fractures were on the second and third metacarpal.
Just stop there. Side. So that is the second metacarpal would be the index or trigger finger.
The index and the middle finger, we call it.
Okay.
Call it the middle finger.
No, I'm saying this finger.
Yeah.
The first finger, the index finger, and then the third metacarpal.
Yeah.
Is the middle finger.
Yes.
and the metacarpal bones in those fingers are broken.
They're broken.
Okay, is that clear? Okay, let's go to the next thing.
So the next sentence says there was a fracture on the distal ulna, and then the distal fifth metacarpal of the right hand.
Okay, so now we've moved to the right hand. I want to start from the end, then we'll come to the beginning of that sentence. You say there is a fracture on the distal fifth metacarpal. So what's that?
Pardon?
Your letter says there is a fracture on the distal ulna and, so I'm starting from the end. So I want to start from the distal fifth metacarpal.
Also, okay, distal fifth metacarpal of the right hand. Yes.
Yes. So
so we've already defined the metacarpals.
Yes.
Yeah. So when we are defining bones, the distal is the one which is away from the head, and the proximal is the one which is near the head.
Okay.
So it is just at the base of this.
At the base of the palm.
Of the
finger.
Of the head. We call it the head, but you can call it the distal part of the metacarpal, of the fifth metacarpal. That's on the right hand side.
So let's first be clear. Are we talking about the pinky finger?
Yes, on the right hand side now. I'm on the right hand side because I'm following what I wrote.
Okay, so on the right hand side.
I'll come to everything. Yeah.
Okay. So on the right hand side, maybe just repeat again so we are clear.
So on the right hand side, we've the patient had a fracture of the distal ulna.
Yes.
And the distal fifth metacarpal.
Okay, so there are two fractures, right?
Yeah, those were two fractures.
Maybe let's explain them in the order that you wrote them. So what is a fracture on the distal ulna?
So we say that this is the ulnar bone.
Yes.
The small bone in the forearm.
Yes.
And its distal part again is this one because it's away from the one.
So the distal part,
so near the wrist, the part that is near the wrist, just below its end.
The bone near the wrist.
Yeah.
And that bone was broken.
Was broken.
And then what's the other injury on the right hand?
There was another fracture on the distal part of the fifth.
Of the fifth metacarpal.
Yeah.
And just to be clear, the fifth metacarpal represents which finger?
The pinky finger on the right.
Okay, now let's go to the next bullet.
So the next bullet, I found the tip of the same pinky finger falling off. You know, it was just falling off from that finger. It had sort of, like a degloving injury that is tearing off the tip of that finger. And I think that is self-explanatory.
Yes.
Right? Yeah.
Yes.
So it was, like a circumferential injury, and the thing is dangling or falling off.
So the finger was dangling.
Yeah. It was that state.
The bit of the finger. The tip. And that's on the right hand.
Yes, on the right hand.
Doctor, now go to the next.
So on the next paragraph of sentence, all the injuries were closed.
Just hold on. Injuries were
closed.
Okay.
Except there was a gastello 1 fracture of the second metacarpal.
A gastello 1?
Yeah, gastello 1 means that.
First spell it.
Gastello is a classification for open fractures. So gastello 1 fracture of the second metacarpal, and gastello, gastello, depends on where you come from. It is G A-S-T-I-L-L-O. It's a semi-classification method.
Okay, so you have the gastellar 1 fracture of the second what?
For the second metacarpal,
On the left hand.
yeah, on the left hand,
And
the tip of the, of course, the fifth finger of the right hand, which was, falling off. As
now,
I
doctor,
described earlier.
Doctor, just explain to us again what you mean by a gastellar 1 fracture.
Now, gastellar 1 fracture means the wound is less than like a centimeter. It's open, yes, but the wound is less than a centimeter. That's
Just
1.
hold on. The wound is open.
Yeah, there's an open wound near the fracture, which is less than a centimeter or less than a centimeter.
Now, doctor, I need to understand when you say open. Do you mean?
Yeah, the bone is exposed under it. The fracture is exposed under it.
So you can see the fracture.
You can see the fracture. Yeah.
You can see the bone.
Yeah.
So when you say all injuries were closed.
Yeah, the rest of the injuries were closed.
So you couldn't see the bone.
The bone, yes.
Okay.
Apart from that one,
just hold on. For the rest, you couldn't see the bone. Then on the fracture of the second metacarpal, what can you see?
That one, the bone was exposed, where you could see the bone through the wound that was there. The fracture, or the fractured bone through the wound, right?
And you could also see the bone on the which other part?
For the fifth finger, because it was deglabbed, it was coming off. The flap was coming off.
That's the first gastellar injury is on the second metacarpal of which hand?
That is the left hand.
Oh, and that would be the middle finger.
The second, no, that is the index finger. Understand?
Oh, that's the index finger.
Yes, I may name them. That is the index finger.
Okay, so we have an open injury on the index finger.
Yeah.
What is also known as the trigger finger. And the other open fracture you have is on the, you call it deglab. You keep using the term deglab.
Deglabbing is like the flap, the whole flap is coming off. The skin, the whole skin and the underlying tissues are sort of coming off, and they are just hanging by a little piece of tissue. Okay.
Okay. Please go to the next sentence.
So she had extensive soft tissue swelling of both hands and the wrist.
She had what? Extensive?
Soft tissue swelling of both the hands and the wrist.
So what does that mean? What's soft tissue swelling?
So usually, most of the swelling goes to we call this one the dorsum of the hand. Okay. So it was really swollen.
So the back of her hand was swollen?
Yeah. Swollen in both hands.
And what does it mean for the wrists?
It means that they are painful and they are numb. You know, they are painful because it was fresh trauma.
Okay.
And usually that swelling, immediate swelling, usually may be from bleeding or saturational disruption, okay, from the trauma, or inflammation following trauma. Those are all three possibilities. But usually, because it's so early in the injury cascade, you take more. It's more of swelling of the internal bleeding, right? Yeah. Okay. But if it was some days, maybe you can then think about the other differentials.
Okay.
Because when we get injuries, it's not just the bone that is broken. Usually the soft tissue is also affected.
So it's not just even the soft tissue.
Yeah, it's usually affected in that manner.
Okay, doctor, kindly take us to the next sentence.
So I assessed the neurovascular status.
What does that mean?
You go to assess the function of the nerves circulation in the hands.
Okay.
So we have three nerves that supply the hand.
Okay.
The ulnar nerve, that because we usually do skin assessment from the skin. So the ulnar nerve supplies the the small pinky finger and half of this finger, right?
That's the pinky finger.
Assessing from this finger.
Hmm.
Okay, and then we have the second nerve, which is the median nerve that supplies the palm.
Okay.
Palm, right, of the remaining fingers. And then on the hind part, then you have the radial nerve. And we have specifically as where we assess from the integrity of those nerves, right? For the ulnar nerve, we assess from the small finger. And then the median, you can assess it from the anterior of the index finger, right? Because you want an area where there's no crossover or anything like that. And then for the radial nerve, you assess from the first web. So I assessed and I came to that conclusion that both the nerves and the saturation were still not affected in that regard.
So the nerves were not affected?
Yeah.
Except for?
Except for, the statement is continuing, okay?
Yes.
So her neurovascular status was normal for all the fingers apart from the fifth right finger, okay? The fifth finger on the right hand, which had lost sensation because, of course, of the obvious nature of the injury that was degloving. Because when it's degloving, everything is gone, most likely. But usually I'll come to what I did and the reason why I did it. Okay.
But you're saying but?
No, I think I will come to that. Let me not interrupt the flow of the report. I'll come to that. So the next statement says that Miss Mele was taken to theater, and after her scalp surgery, ORIF was done of all the fractures, and
ORIF is just
open reduction and
open reduction.
Yes, and internal fixation.
And internal fixation
Using pins. These are soft, small K wires. Because of the nature of the injuries, you don't want to put in heavy metals, and which may get affected. So we use soft, not soft, but smooth wires, small wires. This is a small part of the skeleton. And we support them with back slabs. A back slab is something, there are two forms of slabs. You can use either this white one, which has even powder on it, or you can use the Dynacast. The Dynacast is the one which is fiberglass. But both do the same thing, but the good thing about Dynacast...
Doctor, you're talking too fast.
Talking too fast. Yeah. I'm explaining a back slab. So we can use the white type, which has which you dip in water and then you put in after dressing the patient, or you can use the Dynacast, which is a little bit, which has no dust on it. You put it in water and then you apply it on top. And in my practice, I use both sometimes because the other one is softer.
In this case, what did you use?
I used usually I put two layers. I put first the plaster of Paris, the white one, and then I add the second layer because the environment is a bit wet, and I don't want my slab to be affected. So,
and in this case?
Yeah, pardon?
In this case?
So the main slab that I use is Dynacast. But usually I underline it with what? With a layer of the what? Yeah, in this case I use both. I use both usually.
Okay, now
my procedure. So you cannot yeah. So option. So the other one is just to prevent any kind of pressure points, all right? Because this Dynacast is very hard. It's just plaster of Paris. That's what I.
So there's a plaster of Paris
yeah.
and a Dynacast slab.
Yeah. So usually I use both for the following reason, and I want to explain myself. When you use the
So explain yourself slowly.
yeah. When you use the fiberglass,
I want my colleagues.
that's how we are taught. I'm sorry. You're not complaining. It's okay.
Okay.
I'm sorry for what I'm not used to.
No. Please continue, doctor. Don't.
Quotes, but that's why we usually.
No, doctor. The comment is that I am also usually too fast.
Okay, I'm sorry.
At least I'm
So
too fast
this is
for
what I do, because this is 2 years ago, but this is what I do, and this is what I do for my slabs. Usually there is the fiberglass, okay, which is usually colored blue, red, or whatever, and it doesn't have any form of dust. It is very good because it doesn't fluids go in it, but it's very also dangerous when you just use it without underlying it with what? The normal plaster of Paris, the one which is white and powder. So it's a slab, and that's what we did. So when you finish your procedure, you dress the patient with gauze and put cotton padding. So you make that slab and you put it on the patient, and then it dries and hardens so that it supports the pins, okay, the small pins that you use to fix the fractures.
In short, usually,
that's what I do.
So in short, usually use both
Dynacast
and plaster of Paris.
You have to make a slab, to make one slab. Because the POP is gentle to the tissue.
POP is what?
Plaster of Paris is gentle to the tissues or the skin, all right? But when it gets wet, it softens immediately. So I underline it on the Dynacast, right, from my slabs. So that's what I do with my slabs.
Now, doctor, still on that paragraph, yeah? You say Miss Molly was taken to theater and after scalp injury, ORIF was done. First of all, I have two questions. The first one, why was it after scalp injury?
I'd explained myself that the scalp injury was more critical or more of an emergency because the scalp was bleeding a lot to an extent that she required transfusions even after the surgery. So it was bleeding a lot, and we know this in anatomy. The scalp has so many vessels. Once it opens up, there's a lot of bleeding under the scalp. So we needed to first make sure that she's alive and she's safe from those injuries of the scalp before we handle the other injuries. That's the chronology of how we did the work.
Now, you then say ORIF was done on all fractures with pins and slabs. You've explained pins and slabs, but kindly and very briefly explain to this court what you mean by ORIF.
Okay. So the procedure that we undergo when we are going to do surgery, there are routine things that I don't talk about in the report because it can become so long. But you first assess the injuries, right?
So is that part of the explanation of ORIF?
Yes.
First tell us what ORIF is in full.
Yes. Because
first tell us what it is in full.
Open reduction and internal fixation.
So ORIF is open reduction and internal fixation. And now you're telling us what you do when you're doing ORIF.
Yes. So usually you expose the injured parts. Okay. Take off all the dressings. You get copious amounts of antiseptics. Right?
What do you mean by copious amounts? You mean?
A lot of antiseptic solutions. And the solution we use here, that we used is the Savlon. It's called Savlon. Savlon, yes.
Okay.
Or the other name for it is chlorhexidine, but I can go with Savlon, SALVAN.
Okay.
And you clean thoroughly to ensure that there is no foreign particle on the parts that you're going to work on, because.
So just slow down. You clean thoroughly to ensure that there is no what?
Foreign particles. on the part you're going to work on or the area you're going to work on. That is the hands, the fingers, the wrist, the forearm. You clean thoroughly up to about mid-arm, right? That's what I did.
So that means that there are no, what would be removed from the hands?
Any foreign particle. That's what we use in
any foreign particle would be removed.
Yes. And usually when you finish with chlorhexidine, you can then we do the rinsing, okay?
Okay.
Of the open injuries. Make sure that even more.
What do you rinse with?
We rinse with normal saline. So we rinse the wounds to make sure there is no visible or invisible particle that is left.
There is no visible or
invisible particles left. And then when we finish to do that, that's when you go to scrub. Scrubbing is when you remove the gloves that you've been applying, because and then you are going now to become sterile yourself.
Okay.
To work inside on the patient tissues.
Speak into the microphone.
So
scrubbing is what?
After that thorough cleaning,
yes.
Then you go and scrub. We went and scrubbed, all right, to come and work on the patient. Scrubbing means you scrub your hands and your wrists and your forearm, all right?
Yes.
And then you come and apply drips, which are sterile.
What are drips?
Drips, these are the gowns that we put on in theater. They are usually blue in color and waterproof or blood-proof. Okay. Because we have to protect ourselves. And from that time, you don't touch anything. And then you glove with the surgical gloves. Okay. These are very sterile gloves. Okay. So, and after doing that, then you are handed a sterile basin, or we call it a kidney dish in our medical term, yes, which has gauze, and they pour there povidone iodine to provide more sterility and cleaning.
You pour what? You pour what?
They pour povidone iodine.
Povidone.
When we start,
yeah.
you pause.
You pause. Okay.
My Lord, is this witness giving us general procedure that he ordinarily does, or is telling this court what he did?
You ask him that because he is.
Then scrub ourselves to sterilize ourselves. Scrub our hands, in there. Then surgical. Then get a sterile basin. Which there is.
My Lord, if God got it like that, then
So just for the cover to my colleague, is this what you did?
This is what I did.
Okay, continue. So you are telling this court that you have a basin which has a gauze called povidone iodine.
It has gauze, and then we pour there a solution called povidone iodine.
Okay.
All right. Mm-hmm. And somebody assists you to hold the limb, all right, okay, without touching that part. Okay, from here, and then you clean thoroughly with that povidone iodine to remove whatever.
Does this court still believe that this witness is testifying what he did, or the general procedure of what he's supposed to do?
That's what I did. Maybe my language is confused. Oh, okay, fine. Okay. Okay. All right. But okay. Thank you, my Lord. I'm sorry we work as a team, but it's fine. I'm the lead surgeon, but
so somebody helps you to hold?
Yeah, somebody helps me to hold. That's why I'm using Prodo, but I'm the one who did the work.
My Lord, I think maybe just for purposes of clarity, the witness is explaining to us because he wrote that he did RIF, and he's explaining that to us.
I'm explaining the procedure I did. To him, okay. Yeah. So then I scrub the patient, all right?
Yes.
Scrub the patient thoroughly on the front part, right, of the all forearm and the hand and fingers, right, in the webs. I turned I scrubbed the patient to ensure that the whole forearm was painted, okay, before the procedure. And after that,
What do you mean by painted? What do you mean by painted?
I mean that iodine that we use, it paints to make sure that there is no part that stayed without being touched by the antiseptic. So after doing that, the patient was draped, right? Both hands were draped.
What do you mean by draped?
We call them drapes. These are the sterile drapes that we use in theater, that we used in theater at that time. I'm trying to be specific. So the patient was draped.
Yes.
And then after draping,
yes,
that's when I did the procedures I did on her.
And those procedures are the ones which you
yes,
are the ones of pins and slabs which you had explained
yes,
earlier.
that's when I did the pinning, make sure that the fractures are in a good position. And then after doing that, I stitched the wounds very well. And then I put dressing, gauze, and then I made the slabs that I was talking about for both arms. I supported the arms with slabs and a bandage on top of the slabs. And then I recommend that the patient goes what? Back to the ICU that night and then later to the ward. And of course,
go slow. You recommend that she goes to the ICU and then later to the ward.
To the ward, because she was still critical in that first day. And then when she stabilized, then she goes to the ward. And of course,
just slow down. And of course,
arms raised to avoid the swelling continuing.
Okay.
They were raised. So then the follow-up was now after that. Yeah, what I explained. Yeah.
So doctor, just clarify one last question on that clinic. Where was it? It was from which part of the hand to which part of the hand, and on which hands?
I clarify what? The cleaning?
Yes, it was from...
I said everything is cleaned from the tip of the fingers,
yes,
the palms, the wrist, the forearm, up to the mid-arm. Because you have to go beyond where the injuries appear.
What about the webs?
All the webs. Those are the fingers, the whole circumferential part of the fingers, and the webs.
And that was for one hand or?
Both hands. Both hands, because they had procedure.
So doctor, then the next paragraph says what?
So Miss Molly is currently receiving antibiotics and analgesics and is recovering. That was on the 13th of November. And the pins will be removed after 4 weeks. Okay? Usually by that time, the bones are joining. We have we know the pathophysiology of fracture healing. So the hand, 4 weeks usually, the fractures are sticky enough to allow the pins to come out. Okay. Can I proceed?
Wait. Okay. Maybe let's have a translation.
Yeah, translation.
Asomeremu kandi nti Kabulo ky'okwezi 13 omwezi gwe 11 omwaka 2022 obulihandikirwa omukulu eby'obwomeezi w'ekitongole kya poliisi. Mole akaija akasiika akayitibwamu abalwaire abalikubi aina okudwa kw'omusaati aina okwatika omubiri nebiwuta bingi hali emikono ye yona obunyarugira hali otanda omumaka kandi ebiwuta biryo bikaba birimu okujwa kw'omusaayi hansi y'omubiri, ekikabani kyolekebwa okwiragura w'omubiri kandi ekikabani kyoleka nti kabaireho okujwera omunda okuluga ha nkonokono okuhikira kimu hansi ha nkokora. Akabaina amagufa agacwekere ha mukono ogw'obulyo kandi hakaara akakabiri nakaara akakasatu. Mukono gw'obulyo harubaju akarora eigufa erikaba riri haina enkokora kandi erikusembera hari akaara kakuherera naho kakaba hariho ekibuta. Iguru yakaara kaba hakutaire kandi akaara nikalengeija kari haihi kucwekaho. Ebibuta bino byona ebikiro wingi bikaba biserekerwe baitu ebimu n'ebimu okaba nosobola kubirora gamba nka ekyabaire hali akaara kakabiri kandi ekyabaire hali akaara ako akaherera akasembayo ha mukono. Akaara kakataano nako kaba niko kali kasero katito muno kaina kandi katito muno akakakwatireho. Hariho okuzimba kw'obunywa obwora obutaito omu mikono yoona enyuma y'omukono ekikoleka nti mazima kwakabaho obulumi bwingi muno kandi halimu n'okusarara okwabaire kuleeserwe okujwera omunda. Kandi hano akabaire okwetegereza empeereza n'okulwata kw'omusaayi omu mikono okulugira hali akaara kaherera oburundi hali akaara kakabiri okusigikira hali obwana baitu ali okwenda kwetegereza. Kandi kino akasanga kiri nikyo ekya buli kiro okwiyaho ekyabaire hali akaara kaherera ekikabani kyeyoleka kyonka. Obwire buno bakabutwara musibasebezebwamu bakozesa ebintu nga obuwayawaya obutaito kandi obukoroba bagaruka basabika nekiseminti. Omutwe gukaba nikujwa muno omusaayi kandi kyaleetaagisa nti babanze babasole hali ekyo basobole okurora nti mu meezi nibo beyongere kumukoraho. Hanyuma y'ekyo bakakora ebibakora buli kiro nga okunuura ebikooya kandi bagaruke babiterekereze kurungi. Ebikooya bino byona bikakorwaho kandi halimu okubaza okwogya rundi okusebeza kurungi muno kurora nti kakwika yaragira nti omulwaire agende mukasiika buno obwayo bateeremu akabali bujja kuba libugamu hanyuma y'omwezi kamu.
My Lord, just for the record, Mr. Chumwebaze is in court. Doctor, maybe before I go to the next sentence, what was the purpose of all that cleaning?
The purpose of the cleaning is to ensure that there is no visible or invisible foreign material or contamination in the surgical fields before we put pins into the bones. Because if we do
Slow down. Before we put
pins
pins
pins into the bones. Because if we do that, we risk the patient getting infection into the bone.
Thank you.
And the soft tissues.
Okay. Now, you had read the sentence which says she's receiving antibiotics and analgesics. I think it's clear to us what that means, but could you explain to court what analgesics are?
They are painkillers. They control pain. After, if somebody has pain, it's the analgesics that will take out the pain. Analgesics are ANALGESICS. Analgesics. The medical term of painkillers.
Can I go to the next paragraph?
So the next paragraph, I say that all injuries over the wrists, arms, hands are pathognomonic of defense injuries.
So just so that all injuries over the wrists, arms, and what else?
Are pathognomonic of
Spell that word.
Injuries.
Spell that word.
Patho.
Yes.
THOGNOMONIC.
Of?
Defense injuries.
Defense injuries. So, doctor, can you explain to this court what pathognomic of defense injuries means?
Okay. When somebody is facing assault or whatever it is, or somebody trying to hit somebody, the natural reaction is to cover the sensitive or vital parts.
Sorry, when someone is facing
is facing somebody and they're trying to hit you.
Yes.
So the natural reaction is to try to what? To cover or defend the what? The sensitive parts.
So the natural reaction is to cover the sensitive parts.
Sensitive parts, depending on where the whatever the assault, whatever, or whatever is coming from. Okay. And the natural defense position that people take, if you see anybody being assaulted, is to try to hide their face as much as possible. So they try to do this. So you try to hide your face. Okay?
Yes.
And you usually do this.
By that you mean you put your hands over your head?
Of the head, or you try to. They are the ones which you try to put there to defend yourself as, No,
doctor, let's first describe that, because remember we are recording. So you put the hands over the head.
The head to try to defend yourself. Right?
Yes.
And you try to hide your what? Your face. That's the natural position.
Okay.
And
so you put, where do you put the hands over the head?
You try to defend your head in this position, right?
Okay. So and the position, just pause where you are.
Yeah.
Just so the position can be described, that is hands over the head.
Of the head, yes. This is the position you try to attain, because somebody is trying to hit and you are doing that. You're doing that. Okay, you're doing that. You're doing that because you don't want him to hit your eyes, So that's the natural defense position. And that's why.
So the natural defense position, doctor, because you were demonstrating just.
I was demonstrating.
The record
is.
My Lord, practically the lawyer is testifying, witness is testifying.
My Lord, that is an objection. Maybe.
So it's getting clarity from me as an expert.
No. Let him finish what he said and then you ask him.
Yeah.
Much obliged.
So much obliged. So when somebody is coming to hit you, you try to avoid him hitting the face, because they are sensitive parts like the eyes and whatever. So you usually try to, you do that. Or you do that, depending on where the weapon is.
That is what? Describe that.
So this is a defense position, all right? You try to take a defense position.
So my question is, when you stop there, that is covering your face with your hands.
Yeah, with your hands and your forearm.
That is again what we are.
So those are the position.
Please, doctor, allow us
okay.
Also do our work.
Yeah, do your work.
My Lord, let me rephrase the question.
My Lord, what we are.
My Lord, I'm going to rephrase the question. I'm conceding. I'm rephrasing the question. My lord, there's no need for speed. So, doctor, you have just demonstrated.
Please, we've had this interruption.
Yes.
Let's move quickly.
Yes.
Just ask the question. Let him explain.
Yes. So, doctor, you have now demonstrated. I want you to reduce that demonstration in words for purposes of us recording it. If someone is to read it, if we are to read it later, we must be able to.
So, when somebody is facing assault, right?
Okay. I'm speaking to the microphone.
When somebody is facing assault, right? Assault, the natural thing to do is to protect your sensitive parts, like the eyes, the face. And you try to take away the face, and you bring the arms to try to protect yourself from something hitting your head or something like that. And this is the position that you usually take. And the reason why we call them defense injuries is that these are injuries which are acquired when somebody is trying to what? To defend themselves. And as you note, when you do this,
So these are injuries acquired when someone is what?
trying to protect the sensitive parts of the face.
Okay.
And as you notice, the reason why I call them pathognomonic or very, very, very strongly suggestive of defense injuries is because all the ecchymosis that she had, or the bruises she had, were on this part of the forearm, the ulnar side. And then the hands, which also come in what? In that position, right? So that's why I call them pathognomonic of defense injuries.
So they are you call them highly suggestive defensive injuries because the injuries were on there.
Specifically on the ulnar side of the forearm, okay? Right? On the side of the forearm and the hands, all right, which usually you put on top of the head as somebody is trying to what? To assault you.
Okay, now, um, uh, now, doctor, as you worked on her through the surgery, were any photographs taken?
Yes.
Who took them?
Pardon?
Who took the photographs?
The nurse. Because for us as surgeons, we are gloved and we are sterile. But if you had to get a record, and we didn't take this for the media, these are for your own record.
Okay.
Surgeon.
Just slow down. So they were taken under your direction.
Yeah.
My lord, I withdraw the question. I withdraw the question.
No,
But I withdraw
might
it.
not be clear. Actually, we may have my lord here, probably, for cross-examining this question, going by the manner our colleague has chosen.
Withdraw that question.
My lord, we can't request going forward. We appreciate that we withdraw, but going forward, maybe start our hand. Stop being suggestive. This witness here, we want to hold him accountable for his own words, and we save on the time for process. Because it is going to be very difficult, my lord, on the record to know which words were put in the witness's mouth and which words came naturally through his personal knowledge.
My lord, I haven't been leading the witness in an illegal manner. I accept that. But, my lord, I've withdrawn the last question. Yes. And I want to wind up with this witness very soon. So, you are telling this court doctor about the pictures. Maybe you can repeat.
Yes. In the execution of our duties, we get records. And the records are for the injuries and for the x-rays that we took before and after the surgery. Those are the pictures that we take.
I don't feel the
And
mic is on.
they have,
Okay, they have.
so they are available. I don't know what more you want me to.
I want you, doctor. Did you see the pictures after that?
Yeah, I saw the pictures.
So who under whose instruction was the nurse taking pictures?
The surgeons,
Okay.
me and my colleague, Dr. Name, for record purposes.
And doctor, if you are in these pictures, can you identify them?
Yes, sir.
My lord, saw them where?
Okay, much obliged. Much obliged. Where did you see them?
I saw them both after working in theater and even on the ward, because the x-rays, the post-operative x-rays, we take them and the following up of the patient.
Pictures.
Pictures, both. I keep records.
Then X-rays now is saying about pictures. So, do they mean X-rays when they extract pictures
All.
or photographs?
Can I answer? You take photos of all the injuries in real time, okay? And then you take.
Our concern, my lord, is the good doctor referring to photographs as we ordinarily know them, or people X-rays.
Records of the injuries and x-rays were taken. Yeah, we are captured and after the surgery.
Then he says, I saw the picture. That's what the nurse was taking.
Yeah.
And that
Instruction
and I
because
take it that references to the
Yeah. So it was now.
Doctor, maybe you can clarify
yeah,
that point.
let me clarify. So the photos of the injuries and of the x-rays were captured and kept, okay, as a record.
And you, maybe I missed it. Where were you when these pictures were being taken?
Some pictures were taken in the theater because that's when you have the fresh injuries exposed. And then others, we took them after the procedure had been done, few on the ward. On the ward, yes, on the ward, yeah. When you're going to change dressings, because that's the few opportunities you have to whatever to record the progress of the patient. We have those x-rays.
The ones which were taken
pictures.
both in the theater and the ward. Where were you? Were you there?
Yes, I was there.
And if they are shown to you, you can identify them?
Yes, I can identify them.
And how would you identify them?
If you look at the X-rays carefully, they have.
Again, my lord, that is our problem. That is our problem. The lawyer asks about pictures, the doctor answers X-rays.
Yes. So the photos of X-rays have labels, right?
Yes.
Yes. What? Yes, both X-rays and the injuries. And then I saw the patient and the injuries that she had. I saw the scalp and I saw the hands.
Thank you.
So both, I saw both.
So my lord, maybe let me lead him slower. My lord, with your permission. So doctor, just so we can get it correct,
Yeah.
my lord, you will help me if I am off. My apologies. Doctor, you have photos of the injuries. That means of physical photos of who?
Of Mole Katanga, the patient that we managed.
Okay. And then you also have photos of the X-rays, right?
Yes, photos of the X-rays also available. Because X-rays are patient property, you cannot take them away. So you take the photos, and you keep the photos
Okay.
for your evidence, for your records.
Okay. And you are telling this court that if you see the photos, you can know they are the ones because you are saying.
I was there in the treatment of the patient, and I saw. And even the taking of these photos.
And what did you see? Which injuries did you see? Did you see all the injuries that she had?
Yes, all the injuries that she had. On the scalp and on the upper limbs.
So, I want to show you some pictures. I want you to confirm.
We object even before it does. My lord, I think this court needs to be clear as to what the doctor saw. First and foremost, counsel leads him the taking of pictures. Then he answers that he saw the injuries. If we he saw the injuries. And then he is not clear as to his connectivity with the his nexus with the pictures. Did he see the person taking the pictures? Did he simply see the injuries? Did he see the pictures after they were processed? What did he see, my lord, before things can be put in? Can the witness be clear? Because counsel is going through, is going into a technical area that we will need clarity first, even before we raise a legal objection.
Much obliged.
Is he, my lord, what was his role in the taking of these pictures?
Yes, my lord.
In other words, that background is very necessary.
I'll lay that background, although my understanding is the witness had. Yes.
I know the witness is not clear.
He was there.
Was taking pictures under me and Dr. Omen.
Yes.
So some pictures were being taken on his instructions. I suppose the ones being taken on his instructions were the ones of the arms. And the ones that were being taken under Dr. Omen's instructions. That was the portion Dr. Omen.
And then the $1 million question is, when he said, did you see these pictures? He has not. When he's asked about whether he saw the pictures, he answers, seeing injury.
My lord, to
Yes,
save time, I can
he
ask.
has not,
My lord, to save time, I can
let
ask
them
that
be clear.
question.
Let them
My lord, I
be
want to
clear.
save time and ask that question. My lord, if my learned friend
Sure.
could limit his objections, I'm working with him. Doctor may have patience. I want to be quick. Did you see the pictures?
Yes, I saw the pictures. Yes. Of all the injuries.
Of all the injuries.
Yes. And X-rays. So I have all the pictures.
So, doctor?
Again, my lord, it doesn't end there. He saw them from where, from whom, from what? My lord, it's not cross-examination.
My lord,
This is
protected?
electronic.
My lord, shouldn't I be protected?
May not like it, but there is no way.
My lord, can I be
We are
protected?
dealing with electronic evidence. And my lord, if Mr. Kamhanga was doing his part, would not be even wasting this time.
My lord, can I be protected?
But the who, when, where, how, I agree. If it's left out, it can come out in cross-examination.
Yes,
Because I say,
objection is he can't pass them over.
I'm not passing them over. I'm
For
still continuing.
identification. Because the reason I'm objecting is when he raises a question, I want to show you this picture. So he's moving into issues of identification without a proper background. This witness can't identify things without establishing nexus.
My lord, if I can out?
Mr. Morgan.
Yes, ma'am.
Let me read what I.
Much obliged, my lord.
Now, the expression of our duties we give reports. The injuries,
Not in the
and
seat.
the X-rays, pictures. I saw the pictures. Nurse was taking pictures and I saw the pictures after working in theater and also photos of the X-rays, photos of the injuries.
Much obliged, my lord.
Is it? No, no. Yes.
I'm not obliged?
Then that is where the question was asked and answered. If the pictures are shown to me, I can
Now, my
I
lord,
have the photos of the X-ray and I also have the photos. I identified the pictures because I was there during the
I said
and
I was
saw
there
all
when
the
you took the
injuries.
picture.
So the pictures of all the scars
By them.
my lord, from that establishes nexus between the taking of the picture, the process of seeing, the medium of seeing. We are dealing with electronic evidence, my lord.
My lord, this is for cross-examination.
No, no.
My lord, I want to object to this. My lord, really, we should be protected.
were taken
By a third party.
by a nurse.
Then how does he come? How does he come to see them? That is our own issue
Instruction.
of him and his
The
colleagues.
one who instructed.
Yes,
And
Mr.
he said,
Kamega, please
while he
move
was
forward.
on the road,
Relax. Yes.
I'm not going to relax.
So
because
he
you are
saw-
wasting our time.
After working in the theater, and I also saw them on the road.
My lord, by seeing them where pictures are not objects, like they are taken using an electronic device. They can be seen electronic, they can be seen in print form. My lord, there is a reason probably why the defense is not comfortable clearing that area. Because it's a road. It's a road. Can we? No. My lord, they can't clear it by. I would not be objecting if they are not praying to put photos.
Mr. Mwagale, defense, let us clear this.
No, my
My lord,
lord,
can they first understand our concern so that we
No,
say
not
yes?
your
I have
speeches.
understood your concern.
Very good.
Doctor, after the pictures were taken by the nurse, what happened?
That is
my lord, can I say something, my lord?
Yeah.
No, my lord, for clearing all this mess.
let the witness.
My lord, allow me, please, my lord, because these documents which you are taking the witness through are already on court record as prosecution exhibits.
So, Mr. Kariga, then there will be no problem with the doctor telling us what. So, doctor, after the nurse
Yes,
took the
we
picture,
shouldn't even be
what
wasting
happened?
our time.
So, maybe, my lord.
No, let him, after the nurse took the pictures, what happened?
So after the nurse taking the pictures, Your Honor, and I've told you the reason why she took the pictures, because we are gloved and we cannot take them in some situations. She showed me the pictures on her phone, and then I told her to share them with me on my phone. And she shared them with me. And I have them.
Doctor, did you also see printed pictures?
May I have the ones on
But did you see printed pictures as well?
No. I've not seen the printed pictures as yet. I saw the ones that I took through my nurse.
So if you're shown printed pictures, can you confirm if they're the ones you have?
Yes.
My lord, can I protect it?
I am still recording.
Yes.
She showed me the pictures on my phone.
On her phone and shared with me.
On my phone.
So I have the pictures with me.
On your phone.
Even I have them on my phone.
Then, you did not see any printed picture.
I've not seen the printed pictures.
But if printed pictures are shown to you, can you confirm if they're the ones you have?
My lord, that
Yes.
in digital terms.
My lord, I'm not asking my digital question.
We are ready to traverse that road. My lord, if a witness did not see,
My lord,
something in
my lord,
print,
my lord, before you interrupt, Mr. Morgan.
Let's hear what
Yes,
you
yes.
said, then you respond.
Yes.
What are you asking? No, you're not asking the question.
Yes.
What
My
is-
lord,
What is your?
my lord, I'm asking for protection. I'm asking the witness a question. My lord, it is easy to see a photograph and know if it is the one that you have. If you want me to lay that background, I can also lay it. Whether you can see a photograph.
Printed. You said, so
No, I'm not asking about who printed. My lord, I don't intend to tender them. I don't intend to tender them. Don't worry about what I'm going to do. My lord, if I can be allowed, I will not tender. My lord, the objections of my colleague will come at the point of tendering. Let me lead my witness. If what I say is not in the record, it is fine. Let me lead, and then we shall deal with legal objections when I make a legal prayer for tendering.
My lord, our objection is exactly not.
My lord, is that inappropriate?
We are not objecting to the tendering. We are not yet there. We are objecting to asking a witness to identify a subject that a witness says he clearly has never seen. This witness has never seen any printed pictures. Our counsel is asking him if he can identify some printed pictures. My lord, he cannot.
My lord, my question is simply no, Mr. Morgan, you do not distort my question. My question is whether
he can identify
the printed pictures are the ones he has. Whether what he has, what I'm going to show him is a correct reflection of what he has.
And we are objecting because this is not the right witness. My lord, unless
My lord, he's the one who has them.
my lord, can we?
let us have a formal objection.
Let him put his formal question, my lord, then we can.
So you don't even know the question.
So, my lord, I just want to record that my learned friend doesn't know what he's objecting to. My lord, let him make his objection.
Because it's been objective.
My lord, what did Mr. Karanga ask?
You don't know. Tell us.
What's your objection?
He prays to have the witness compare printed.
My lord,
He did see with the soft copy.
yes.
I don't know they have the name. You can't even abandon it. They will make it. Even abandon it. It's necessary. The description is enough. Because
That Mr. Morgan tendered in, my lord. Yes.
My lord,
Yes. Yes.
who is providing that?
And their prosecution exhibits.
No, my lord, can we avoid this
My lord, the prosecution shouldn't be allowed to suppress evidence.
kind of? What kind of, my lord, can we keep our calm?
It's you who has cardiovascular shock.
We are objecting, my lord, to defense attempts. We invite this witness to make comparison of some alleged printed pictures with what he alleges to have on his phone. My lord, we are using alleged on purpose because one.
No, my lord, I want to object. My lord, my learned friend raising an objection should cite a law and go objection. My lord, I want to object. This is not a submission. No, my lord, my prayer is let him go to the law. Let him go to the law. Yes, but no matter what I'm objecting to is setting a background, brief facts, submissions. My lord, let him go to the law of his objection.
My lord, can he cite the law which prevents me from doing exactly what I'm doing?
No.
The
one
he
I
wants
can't.
the law, my lord.
I can.
One objection.
My lord, yes.
But my lord, you should be succinct and to the point and to the law. My lord, objections are supposed to be legal. I am allowed to ask this man anything unless it violates the Evidence Act or a law. So my learned friend, yes, my lord, I am objecting to the practice of speaking for 30 minutes without citing a single law.
Mr. Allow Mr. Mwaganya, but Mr. Mwaganya, be mindful of the time.
My lord, I am not just mindful of the time, I am even more mindful about the justice of this process.
Or the injustice.
Mr. Mwaganya,
Yes.
but
Not with the law.
let us get quickly.
Lord, where did I stop before I was?
What the alleged prosecution is using the term alleged because the witness
Has not been led to first tendering what he has, what he says he has on his phone. It's unknown on record. Secondly, my lord, issues of comparison of electronic evidence can only be done by persons that are specifically trained to do the said comparison. My lord, no evidence has been laid that Dr. Sachin, in addition to being what he says he is, he also possesses expertise in photographic analysis or comparison. But third, my lord, the witness has been clear. He has never seen any printed. His knowledge is can only be restricted to what he electronically has on his. My lord, the provisions of the Electronic Transactions Act. Let me pull it up. Section 8
new one.
Yes, the revised one. Battery is running low.
It is the one we quoted last time and then
Let me just pull it out, my lord.
the section we quoted and it was rejected. The one we quoted was
Yeah, this should be the revised one, my lord, because the session was previous. So subsection, my lord, section 8 deals with admissibility and the essential weight of data messages or electronic records. My lord, under section 2, a person seeking to introduce, section 8.2, a person seeking to introduce data message or an electronic record, legal proceedings, the burden of proving its authenticity by evidence, capable of supporting a finding that the electronic record is what the person claims to be. And my lord, in the same act, the test is to that witness must not just prove originality or authenticity, but reliability. My lord, when the law says that says a person seeking to introduce, my lord, introducing is not at the point of tendering. Introducing is at the point of raising the issue. So, my lord, the moment a question is raised as to any electronic message, data message, in this case, my lord, the photographs tendered, the photographs taken, then the rules set out in the act must be immediately complied with. My lord, number 4, this objection has a basis at the commencement of defense case. We went on record, my lord, requiring, my lord, electronic copies, soft copies, my lord, of the pictures alleged have been taken of A1. My lord, we are on record. Those soft copies, my lord, have never been available. Now we know that they exist, but the person who has them, who has admitted on record to having them, my lord, is not being led to tendering them, but he is being invited, my lord, to look at other materials that he has never seen before, the printed pictures. and to tell this court that they rhyme with what he purports to have. The witness doesn't possess, at least he has not been led to prove that he possesses such skills, comparison, but also, my lord, he cannot purport to compare any material with any materials that he had never seen before with what he claims to have, and it is still in his pocket, not on record. That is why we object.
My Lord, I just want to very briefly reply to the very lengthy speech of my learned friend. My Lord, I'm responding. Can I not be blocked from? Can I not be blocked? No.
I have taken it. I have taken it regularly, my lord. Can he just refrain?
Let Mr.
Yes, my Lord.
Katanga proceed.
Yeah, much obliged.
Mr. Katanga, please refrain from making statements. Because someone's submission is
Much obliged. My Lord, maybe let me edit. My Lord, I wish to respond to the very lengthy submissions that my learned friend made in speech form. My Lord, very briefly, my learned friend, after saying so many things, ended by citing the electronic transaction, section 8 of which deals with admissibility. So his objection is premature. Section 8 of what everything he has called by Lord is to do with admissibility. He has not cited a single law comparison. My Lord, as you know, as is on the record on this court, comparison has already happened in this court between WhatsApp messages and printed documentation, even for purposes of admissibility. My Lord, the second thing, Section 8 deals with two things. One is admissibility, the other is evidential weight. The attempt to block this witness from answering the question deals neither with admissibility nor weight. It is simply a bold attempt at evidence suppression. In this case, my Lord, the evidence has already been admitted by the prosecution. I want him to confirm if what the prosecution brought to court is what he observed. If it means I rephrase the question to say, this was brought by the prosecution, is it what you observed? Just compare evidence brought by the prosecution and confirm whether or not their evidence reflects what he saw. As a person who was there, my learned friend did not bring an electronic message to this court. Nor did he tender those photographs. My learned friend, my lord, I'm asking this witness to look at a prosecution exhibit.
The prosecution did not tender any.
They did bring an electronic message. I am simply saying this is what prosecution has brought to court. Is this what you saw? If he didn't want it to be before the court, he shouldn't have brought it. And my lord, the record will reflect that in bringing it, he made another very lengthy submission. So my lord, issues of electronic messages is a very premature objection. I will come to electronic after I have dealt with his own exhibit. Much obliged. So my lord, basically, I am not praying to tender any electronic record yet. His section that he has quoted is dealing with admissibility. I am simply asking him to compare prosecution evidence that is already on court record. And my lord, the point I want to make is the justice of this point is that this evidence is already before my lord. It's important to know if that evidence is a true reflection of the facts. That is, this is a fact-finding court. I will then, after that, my lord, seek to tender in the electronic record and respond to his electronic points. No. For now. For now. Yes, I'm not. In the question that he objected to, my lord, I'm not seeking to tender an electronic record. I am simply seeking to have the prosecution already put on court record. I want to give it to him to confirm if what they put on court record correctly reflects what he saw with his eyes. That's what I'm doing.
Yeah, but my lord, our objection is not on tendering. The law doesn't talk of tendering. The law talks about introducing.
It's already on evidence. My lord, it's in evidence.
No, my lord, what is
Yes.
evidence? And I think, my lord, allow us again to address you, because that is a misrepresentation, my lord.
My lord, if it's my lord,
what is in evidence?
my lord, I am
seeking to have the witness look at
a prosecution exhibit.
Which one, my lord?
Yes,
Which one, my lord?
prosecution exhibit 121.
Now, my lord, you note that prosecution exhibit 121 is an exhibit that was entered during cross-examination of A1. It is, we are holding her to strict proof of what she had alleged. It is evidence that her own evidence, my lord, of what she had previously relied on. It is not a prosecution evidence. It is a prosecution exhibit, but prosecution evidence.
What is an exhibit? What is an
Can I?
But it's already, but my lord, it's
Mr.
already,
Karwanga,
Yes.
we can't.
yes, my lord.
It is on record, but what Mr. Karwanga is misrepresenting is that it is on record as prosecution evidence.
As a prosecution exhibit.
My lord, this
It's
is
an
a
exhibit.
material that
It's an
is
exhibit.
materials forming parts of what the accused person had previously adduced, alleged, and brought forward.
Yes, but they are marked PE.
They are marked as prosecution exhibit.
121.
Yes.
Tender.
They are marked
Yes.
as what
And
we
they were
tender.
received on the record through you.
Yes.
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 So, to that extent,
They are received
Yes, my-
on record, my lord,
Yes.
through the accused
the
person
accused person, yes, but
It become your
during
evidence.
during
cross-examination.
your course
Yes.
of trial.
So it is a court exhibit
Yes,
tendered by prosecution.
yes,
Yes.
but it's
My lord,
Yeah.
so,
My
okay.
lord,
but my lord, that's now semantics.
Now, as
Okay.
far as
Can I finish, my lord?
But you need a given link.
I thought you had finished.
Yes.
No. There is a misrepresentation that the photographs that we tendered, by the way, we tendered them as adverse evidence. You know, we never laid them as prosecution evidence.
That can
We
be
tendered
addressed.
them
That can be
as
addressed
adverse
at the
evidence.
time of submission.
So
Yes. Much obliged.
Yes,
Yes.
that can be
So-
addressed at the time of submission.
Now, what Mr. Karanga is misrepresenting is that we are objecting to tendering. No, we are objecting to introducing.
Oh.
And the law, my lord, doesn't talk about tendering. Subsection 2 talks about introducing. The person seeking to introduce.
Introduce where?
Not tendering.
And
The
we are not
procedure-
introducing.
In other words, my lord, if you intend to introduce that subject and traverse it for whatever purpose,
No, my lord, I really want to object to my lord
A person seeking to introduce
in evidence.
a data message
In
or an electronic record in legal proceedings has
Yes.
the burden of proving its authenticity by evidence capable of supporting a finding that the electronic record is what the person claims it is.
Yes, my lord.
Subject to
So, my lord, I'm not introducing an electronic record, just for the record, my lord. And what I'm asking the witness to do,
Remember that there is also, when assessing the evidential weight of the data message, one electronic record, the court shall have regard to the reliability of the manner in which the data message was stored or communicated, the reliability of the manner in which the manner in which the originator of the data message or data record was identified and any other relevant factor.
I'm not talking about a data message here.
So,
We're doing a
data
picture.
message or a record
that's
or
a,
an electronic record.
yes, that's weight.
So it's not anything. It's none of the two.
It's a data, it's an electronic record.
My lord, it is his own. Prosecution Exhibit 121 is not a data record.
No, what he has.
Yes, I'll come to what he has, which is the second question. Yes,
what is seeking
So I think
to compare with.
my lord,
what the witness can do
my
in
lord,
respect of those pictures,
on his phone
which not on his phone, on those ones that are
in court. Yes,
what he can do is to quote whether those are the pictures.
much obliged.
Not to go against what was on his phone.
Much obliged.
He's not the one who took them.
Now, my
Much
lord,
obliged.
That is exactly what
My lord, I'm much obliged with your ruling. And my
my lord, there we shall be going. In
my lord, I think the culture of objecting to rulings must stop.
The document is already.
My lord is already on court record, but this
So he
witness
can
cannot.
identify them.
He cannot because he has been
Mr.
very.
No.
He has been very categorical, my lord.
My lord,
He has been very categorical that he has never seen any
That
printed
is what he's
images.
saying. So let
Yes.
us hear it from him.
yes,
Has he ever seen them?
So let him tell us. Let us read him there. I know what
yes,
he's saying.
yes.
Let him,
My lord,
so let
and-
him answer.
but my lord, before that, I really want to object to the
Has he seen those pictures before?
Okay, look at those pictures and tell us. Listen to my question carefully. Do they reflect what you saw, and have you seen them before?
No, have you seen those hard copies before that you have?
In any form?
Have you seen those? No, have you seen those?
Yes, doctor.
These are the very pictures.
Have you seen that?
My lord, my lord. No.
But it's, yeah, it's fine, it's fine.
No, don't threaten the witness. My lord, he's threatening the witness. My lord, he's threatening the
I
witness.
didn't know that.
My lord, can I say something? No, Mr. No. My lord, our witness is being threatened by a state judgment. Don't threaten people. We have no such right.
You are wrong. You are a lawyer.
My lord, he has no right. And my lord, I pray for protection. Shouting at the witness and threatening him.
Also pray for
No.
protection.
My lord, let me speak. My lord, let me speak. My lord.
You want to No, you can't. You can't also gag us.
You can't drag a witness.
Zawadi.